Okay, supination lag test. I'm sorry they're coming out a bit randomly, but hopefully it'll just keep us a bit more entertained. What I'm going to do is just pop you up a little bit, because you're tall. And what I'm going to do is ask you, I think because of the camera, we'll swing you around that way. If you can just switch yourself around so that your legs are dangling at the side. That's lovely. Okay. Now the thing to remember here is you've elevated your patient, they're now dangling half off a couch, so you've got to make really sure that they're able to get into that position safely. Don't do this on someone who's just had a stroke, for example. That wouldn't be a good thing to do. So this patient will have come in complaining of usually medial ankle pain, and again it will have an insidious onset, so nothing major happens necessarily, but often they will tell you that they've increased their activity. So sometimes, especially down here, we've got a lot of events like moonwalks, half marathons, those kind of events that come around in the calendar. I tend to see a few more patients coming in complaining of medial ankle pain. So they'll complain of it just behind, normally behind the medial malleolus. What do you think I might be suspecting if they came in? Which structure? Posterior tibial tendon. Well done, yeah, tibialis posterior. So it's one of the three tendons. Do you remember Tom, Dick and Harry? So one of the three tendons, Tom is tibialis posterior. Do you remember what Dick was?
Tibialis anterior?
No. It's a flexor, their flexus
digitorum.
behind. Yeah, flexor digitorum longus, and therefore the H is, Harry?
Hallucis longus.
Flexor hallucis longus. So tibialis posterior is the one that is closest to the medial malleolus and becomes most superficial around this area. What does it do? What's tibialis posterior's job? It is an inverter of the foot, yeah. So what does it do in its day-to-day life? Because they don't normally do their concentric action quite so much. They do eccentric, so they're resisting pronation, exactly right. So we can do two, we got there in the end. See, that group collective intelligence is great. So we can do two tests. We can test that inverter function, which is exactly right. We can do that, and that's what this test will do. We should always compare that also with an eccentric test as well, so stress testing, which we'll do later on. So you're going to ask your patient if you can clap your feet together, the soles of your feet, okay? That's right. The seal noises are optional. So what you do is you're going to just ask them to go back to normal, and then just slowly go to do just one, so inverting.
Oh, just one?
Yeah,
one.
Sorry, no, do them just instead of the multiple claps, just the one clap. And what you're looking for is for one of them to lag behind. So it's a supination lag test. So one of them will go all the way, and one of them will only go so far, and it'll not be able to quite make it. Okay, so as you can see, Jonathan's got an excellent range of bilateral clapping of the feet, which is lovely. Yeah, it's great.
Still there, like sorry.
Yes, I've still got it. What test do you think might be useful to go with this one? You know, if he has got a restricted range.
Doing the opposite.
Possibly, yeah, you could compare it with that. But what might be another reason for restriction of range? We just talked about it with the talar tilt. Coalition, tarsal coalition, when the bones are actually joined together and not allowing that freedom of movement.
We're talking about it on Wednesday.
Oh, great. So I'm being a little bit unfair presenting you with all this right now, but I just want to put it all in context, so when you do meet it, you'll go, oh yeah, that's what she was talking about.
Is that the sinotarsal when it's fused with the...
It's normally calcaneonavicular, isn't it? That normally,
yeah.
But you can get several. It's a bit complicated. Some of them are fibrous, some of them are
And that's a congenital defect.
Yes,
Yeah.
yes, that's right. So it's a failure of the tarsal bones to separate with programmed cell death.